I know from a lived experience is that when you don't talk about an issue, when you don't talk about a health problem, all you do is you add a layer to that problem, or you justify the embarrassment, or you justify the fear of not going to the surgery for fear of bumping into someone, and then that leads to, say, more of a physical ailment, or again then maybe more of a mental health problem by not addressing the issue. And this campaign ultimately is to break down, the barriers of fear and embarrassment that we have. And just like the fireman said, we live in a fragmented world, and where we're fearful or embarrassed of other people's reactions towards our physical or our mental well-being. Therefore, we end up becoming a worse society for not being able to talk about it.
And how much is it up to women, do you think, Gareth, in order to speak to their menfolk, whether it be their sons or their brothers or their partners or whatever? Because women are more forthcoming, aren't they? They are more willing to go and see the doctor if there's an issue, whether it's physical or mental. Do they also have a responsibility to look after their men's health?
I feel there's a responsibility on everyone, but yeah, I think women have to play a part as well, or just to ask the questions. I think sometimes men are afraid of raising a topic for, say, the embarrassment, or creating an environment where they feel they would be judged or feel they would be ridiculed, whether that's by men or by women. So I feel everybody has a role to play to create an environment where we start talking about issues, whether they be mental issues or whether they be physical issues. We start conversations around it, and we all know when groups of men are together, then they don't always talk about things that they should be able to talk about for fear, say, of the embarrassment or rejection. But some of my greatest friends are women, and some of my greatest conversations and some of my greatest kind of achievements have come from having conversations with women as well. So I feel like women do have a big role to play in this as well.
So what's your top tip then for men who are reluctant to talk?
Well, I think what's great about this is what they've created is an online doctor service. So where men are fearful of talking, or maybe fearful of going to a clinic, or fearful of walking to a hospital for bumping into somebody they know, there's a sense of anonymity through online doctor.asda.com. You can go there and have a sense of anonymity, but also a sense of relief for being able to start to talk about your problem and get one step further. I know for me, even when I was diagnosed, for instance, with living with HIV, which is a great shame to me. Once the doctors, and I started engaging and started listening to what the doctors were telling me, I didn't feel that shame anymore. I didn't feel like I had to have that silence anymore, because I had nothing to be ashamed about. So I had nothing to be silent about.